Imagine this, you're lying in bed, stomach churning, the room feels like it's spinning, and you're wondering if you'll ever feel normal again. You reach for what you've been told might help, a bottle of Sprite. But is it really the answer? Let's explore the real impact of drinking Sprite for stomach flu relief and discuss better alternatives to keep you hydrated and on the path to recovery. What is stomach flu, and why does it hit so hard? Stomach flu, or viral gastroenteritis, is a viral infection that affects your digestive system. When it strikes, you're dealing with symptoms like vomiting, diarrhea, fatigue, and nausea. It's relentless, and it can be tricky to manage because you're not just losing fluids, you're losing essential minerals like sodium and potassium too. This can quickly lead to dehydration, which can become dangerous if severe. But what about Sprite? Some people say it's a quick fix for nausea and stomach upset, but there's more to the story. Why some people think Sprite helps, the 5 beliefs explained. 1. Hydration help. People often turn to Sprite, thinking it can help replace the fluids they've lost. It's true, hydration is essential during stomach flu. But here's the catch, Sprite contains a lot of sugar, which can actually make diarrhea worse, potentially increasing fluid loss. 2. Mild flavor. When you're feeling nauseated, strong flavors are the last thing you want. Sprite's mild, sweet taste can be appealing when almost everything else makes your stomach churn. This is why Sprite may be easier for some to sip on than something like a strong electrolyte drink or broth. 3. Glucose boost. Some believe that Sprite's sugar content can help replenish glucose, especially if you've been throwing up a lot and are low on energy. While this might help a bit, there are better ways to get your glucose fix. Drinks with added electrolytes, like sports drinks or specific electrolyte solutions, offer glucose without making diarrhea worse. 4. Carbonation comfort. The bubbles in Sprite may feel soothing, and some people find carbonated drinks help calm nausea. However, carbonation can also backfire, increasing bloating and discomfort for some. So, while carbonation might be nice, it's far from a guaranteed win. 5. Sodium source. You need electrolytes when you're dealing with stomach flu, including sodium. Sprite contains some sodium, but compared to other options, it falls short on essential electrolytes like potassium and chloride. Electrolyte solutions such as Pedialyte or diluted sports drinks are much more effective in restoring what you've lost. The real deal, why Sprite might not be the best choice. Sprite is appealing because it's familiar, sweet, and easy to drink. However, it's not a top contender for rehydration. The high sugar content can worsen diarrhea, leading to more fluid loss. And while it has some sodium, it lacks other vital electrolytes necessary for true hydration. If Sprite is the only thing you can keep down, you can dilute it with water to reduce the sugar content. But ideally, it's better to reach for something more balanced. What to drink instead? Better alternatives for hydration and comfort. 1. Electrolyte replacement powders and solutions. You've heard of Pedialyte, right? There are tons of options out there, Naturalite, Infolite, and Sprite, to name a few. These drinks have the right balance of electrolytes and sugar, making them ideal for rehydration without increasing fluid loss through diarrhea. 2. Caffeine-free sports drinks. Sports drinks like Gatorade or Powerade can be helpful for rehydration. But watch the sugar. Look for options that are lower in sugar or dilute them with water to avoid worsening symptoms. Caffeine-free versions are best because caffeine can worsen dehydration by acting as a diuretic. 3. Coconut water. Often called nature's Gatorade, coconut water is rich in essential minerals like sodium, potassium, and magnesium. It's sweet, but it's naturally lower in sugar than soda, so it's a gentle way to hydrate without a negative side effects. 4. Ginger ale, but read the label. Ginger has a reputation for soothing nausea, but commercial ginger ales usually contain very little actual ginger. Check the label to see how much ginger is in the drink before deciding it'll do the trick. You could also try brewing fresh ginger tea at home for the real benefits. 5. Savory stock or broth. If you're not into sweet drinks, try vegetable stock or bone broth. These liquids offer hydration and essential minerals, and they're easy on the stomach. Just be cautious of high sodium levels if you're drinking a lot. 6. Ice chips or popsicles. If you're having trouble keeping anything down, ice chips or even a popsicle can help you get fluids gradually. It's a gentle way to hydrate while also soothing your stomach. 7. Chamomile tea. Chamomile tea has anti-inflammatory and muscle relaxant properties that can calm your stomach. It's a great option for gentle hydration with the added benefit of helping you relax. 4. Prenatal screenings and tests. What you need to know around this time, many women begin exploring genetic testing and other screenings. Not every test is for everyone, so it's a good idea to talk to your doctor about what's right for you. Here are some options available between weeks 11 and 14. Nuchal translucency ultrasound. This ultrasound checks for fluid at the back of the baby's neck, which can indicate certain chromosomal conditions. Sequential integrated screen. This blood test is one of the most accurate for detecting Down syndrome. Chorionic villus sampling, CVS. If you're 35 or older, or have a family history of genetic conditions, CVS can test for genetic abnormalities by taking a sample from the placenta. These screenings can give you a peace of mind and a better idea of your baby's health. However, always remember that the decision to test is personal and should align with your own values and needs. 5. Lifestyle tips for a healthy pregnancy. Pregnancy is a time to focus on both your health and your baby's. Here's a checklist of some important lifestyle modifications and tips for staying healthy during pregnancy. Diet. Prioritize whole foods, especially vegetables, fruits, lean proteins, and whole grains. You'll need more iron and folate during pregnancy, so ask your doctor about supplements. Exercise. Staying active can help you feel better physically and emotionally. Low-impact exercises like walking, swimming, and prenatal yoga are often recommended. Avoid harmful substances. Steer clear of alcohol, smoking, and drugs. Limit caffeine and avoid high-mercury fish like shark and king mackerel. Beauty tips. Try to avoid permanent hair dye during the first trimester. Opt for a semi-permanent dyes instead, as they are usually gentler. Medication safety. Always consult your doctor before taking any medication to ensure it's safe during pregnancy. Small lifestyle tweaks can make a huge difference for you and your baby. It's all about finding what works best for you and supporting your health as you bring new life into the world. 6. Closing thoughts. Embrace the journey. Week 11 is just one chapter in the incredible journey of pregnancy. Yes, it's a roller coaster, full of twists and turns, cravings, and sometimes strange symptoms. But it's also a time of rapid growth, and each new development brings you one step closer to meeting your baby. Take things one day at a time, listen to your body, and don't hesitate to reach out for support. Remember, pregnancy is as much about taking care of yourself as it is about growing your baby. You've got this. Thank you for joining this week's journey through pregnancy. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell for more weekly updates on your pregnancy journey. Stay healthy, stay positive, and we'll see you next time.